Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. Go check out reallifepharmacology.com. Get your free 31-page PDF on the top 200 drugs. Great little study guide, great refresher if you've been out in practice for a little while. I just highlight some of the most important things that you're going to see in clinical practice and some of the most important things that you're going to see on pharmacology exams throughout school and maybe board exams throughout your career as well. So go check that out. Take advantage of that. Simply an email is all it's going to cost you. And we also get you updates when we've got other content available. All right. So we are continuing on our list of the top 200 drugs, and we've got numbers 31 through 35 today. The first drug is ethinyl, estradiol, and drospirenone. This is an estrogen-progestin combination oral contraceptive. Sometimes you'll see the generic kind of abbreviation OCs for oral contraceptives. Sometimes you'll see COCs for more specific, more for combined oral contraceptives. So keep those abbreviations in mind there. Brand name of this medication, if I didn't mention it, is Yaz. Mechanism of action, how these combined oral contraceptives work. They block ovulation by negative feedback on the hypothalamus. The hypothalamus then in turn works with the pituitary, anterior pituitary, and that reduces FSH and LH secretion. So FSH is follicle stimulating hormone and LH is luteinizing hormone. And by reducing that secretion of those two, that prevents ovulation, which is obviously what we're trying to do with oral contraceptives and maybe even a more generic term, birth control. All right, now what do we have for risks, adverse effects with ethinyl, estradiol, and drospirenone combination? As with most estrogen-progestin combinations, nausea can occur. Usually the higher the estrogen dose, that tends to cause more nausea. So it's definitely a dose-dependent type effect. If we don't have enough estrogen, we can sometimes get breakthrough bleeding and spotting. So that's kind of the yin and the yang of, too much estrogen, too little estrogen. Also, too much estrogen, we can increase risks for DVT, PE, and other cardiovascular effects. So that can be a downside there as well. Important to remember, patients who are over the age of 35 and they're smokers, these patients are at risk for higher risk for an increased risk of cardiovascular events. So, and there is a boxed warning on this risk. All right, moving on. Next medication, we've got a Presaline. That is the brand name, I should say. Hydralazine is the generic name. And this is classified as an antihypertensive medication. Most commonly, I've seen it used for blood pressure reduction. On rare occasion, probably less common now, I have seen it used for heart failure, with reduced ejection fraction, and that's in combination with a nitrate there. Again, not something I see very often anymore in practice. Used to be a little bit more common, but we've got more and more agents out now for heart failure, such as Entresto and the SGLT2 inhibitors and other medications there. So one of the big downsides of hydralazine is it's dosed multiple times per day, so up to 3 to 4 times per day. So obviously when it's a medication that's not really relieving any symptoms, say we're using it for blood pressure, the patient doesn't feel any better after taking it. And so sometimes it's really, really difficult for patients to remember to take multiple daily doses of a med. So that is definitely a big challenge with hydralazine, and definitely one big reason why I don't think you see it very often there. Classification, it is classified as a direct vasodilator, so basically just opens up those vessels or causes that. Adverse drug reactions. Probably the most highly testable thing that you're going to see with hydralazine is it can cause a lupus-like syndrome. This tends to be a dose-dependent effect. So if you got a patient specifically that you know is on higher dosages, they're probably going to be at greater risk for this. It can lead to some, muscle pain, soreness, joint pain, swelling, and also lead to complications with the heart and liver as well. So definitely can be a significant consequence from the use of hydralazine. And again, the higher the dose, the more likely we are to see this risk. But definitely a good board exam question to remember when assessing antihypertensive agents and hydralazine increasing the risk of lupus type reaction there. Other adverse drug reactions you might see, obviously hypotension. It can drop blood pressure too far, increase the risk for falls, dizziness, flushing, edema has been reported, and tachycardia as well. Next medication, we've got Benztropine. Brand name of this medication is Cogentin. This is an older anticholinergic type medication. I believe it was originally created and shown to be beneficial in patients with Parkinson's disease and treating those symptoms. The challenge with Benztropine in Parkinson's disease is the doses that you have to use generally tend to be higher, and the anticholinergic adverse effects are really, really problematic. So where I've seen it used in practice, I guess primarily is drug-induced extrapyramidal symptoms, dystonic type reactions. Those are most commonly caused by dopamine-blocking agents, such as first generation antipsychotics, metoclopramide's another good example there. So those are kind of some of the indications you may see Benztropine utilized for. So this medication being anticholinergic, adverse drug reactions, you can't spit, see, pee, or poop. It's a good way to remember that. So dry mouth, dry eyes, urinary retention, constipation. It can also cause some CNS changes and increase the risk for confusion. It can also increase fall risk. Rarely it can contribute to hyperthermia. So that's an increase in the body temperature, basically. One of the mechanisms that it kind of does this is it can kind of inhibit sweating and those type of things that help cool the body down. So that is something to pay attention to, particularly in warmer climates, warmer times of the year, and then obviously if patients are taking other anticholinergic medications there as well. One last point with Benztropine, look out for the prescribing cascade. So that's where we add another drug to treat a side effect. So good examples here, artificial tears for dry eyes, saliva substitute for dry mouth, tamsulosin for symptoms of urinary retention, laxative agents for that constipation adverse effect, dementia medications. This is something I've seen in my practice there as well, where we actually start Benztropine, patients have increased confusion, we don't recognize that it's that it's likely an adverse effect, and we start dementia medications because they were inappropriately diagnosed with dementia versus an adverse effect. All right, so moving on, we've got number 34. We've got chlorpheniramine, in combination with hydrocodone. Brand name of this medication is Tussionex. This is a liquid medication that occasionally you will see prescribed for patients with chronic cough or coughing symptoms associated with something there. One thing I always look for whenever I see a cough medication prescribed for somebody that's had a cough for a long time, obviously take a peek. Hopefully the provider prescribing the cough medication has looked at the medication list or recognized if they're on an ACE inhibitor, but you got to make sure that they're actually not taking an ACE inhibitor whenever you see, cough medicine used for kind of a dry, just a dry cough, All right, so these drugs mechanistically, or their classification, chlorpheniramine is a first-generation antihistamine. It's going to have plenty of anticholinergic activity. So I kind of ran through that with Benztropine and some of the challenges and adverse effects you're going to see with an anticholinergic type medication. And then we've got hydrocodone, which is obviously an opioid medication. So adverse effects, obviously, as you could imagine, sedation, constipation, and then those anticholinergic effects as well. Now, before I move on, I got to mention the boxed warnings associated with Tussionex, and there are actually a bunch of them. So I want to highlight some of the important ones here. Obviously, it is a controlled substance, so risk for addiction, abuse, dependence, those are all definitely challenging things there. Respiratory depression. So again, we're utilizing an opioid in the case situation of inappropriately high dose or overdose. That can certainly happen and increase the risk for coma, death, things of that nature. With liquids, we need to be careful for measurement errors, and particularly when you're talking about a higher risk medication that has an opioid in it, we need to be very, very careful that the dose is appropriate and that the patients know and understand how to measure out liquids. Very, very critical to not make the assumption that they're going to know exactly what 10 mils is or whatever the dose is. For any medication, we've got to make sure that they understand and know how to measure out those liquids and what is an appropriate dose and measurement there. Another box warning, benzodiazepine use, alcohol use, it can increase the risk for respiratory depression, opioid toxicity. Really, really important there. And then CYP3A4 inhibitors is also another boxed warning. This can increase the effects of hydrocodone. So again, lots of warnings associated with this. I definitely see a lot less use of this medication than I used to see 5, 10 plus years ago. So, but if you do see it, definitely a few important things to remember there. All right, and then our last one of the day, we've got number 35, and that is Paroxetine. Brand name is Paxil. This is an SSRI, so ultimately it's going to increase serotonin in the synapses of the brain, utilized to treat a bunch of different psychiatric disorders, depression, anxiety, PTSD, and a few others as well. Keep in mind, it can be used to help manage menopausal symptoms. You do see that occasionally in practice where it's we're using a non-estrogen type product to help maybe help with some of the vasomotor symptoms associated with menopause. There is a boxed warning, of course, with virtually all antidepressants, increased risk for suicidal thoughts and behaviors, particularly in younger patients. So that's important to note. Adverse drug reactions, you can have some GI issues, constipation, stomach upset occasionally. Sexual impairment is an important one to remember with all SSRIs, and paroxetine is certainly included in that. Paroxetine is not the best SSRI to use in the elderly for sure. It's got some higher anticholinergic activity compared to the other SSRIs within its class. Another challenge with paroxetine can be tapering off and reducing paroxetine. It does have a shorter half-life, so discontinuing that medication can be a challenge as well, and kind of that SSRI discontinuation syndrome may be a little bit more likely to have with paroxetine than compared to, let's say, fluoxetine, which has generally a much longer half-life. Then for drug interactions, there are some drug interactions through CYP2D6. I'm not going to go into detail on that. definitely go back to the archives at reallifepharmacology.com if you're looking for more specifics on any of these drugs. I've done over 300 podcasts of individual medications. You can find them all at reallifepharmacology.com. Just search the specific drug you're looking for. If you can't find the specific drug you're looking for, I certainly take requests periodically as well. So feel free to reach out to me at mededucation101@gmail.com. As always, if you enjoyed this podcast, found it helpful, please support the sponsor, meded101.com/store. Any purchase there goes directly to support this podcast, help keep it free of charge for all to benefit from. So please do that if you're able at meded101.com/store. Lots of items for anything from pharmacy technicians, pharmacists, pharmacy students, board certification and study materials, case studies, drug interactions, primary care information. So if you're a nurse, PA, nurse practitioner, med student, all the way up to physician, lots of different things available that can definitely help you in your practice and learning and applying pharmacology. So go take advantage of that and obviously help this podcast too. So again, meded101.com/store. Again, if you want to reach out to me, comments, questions, suggestions, mededucation101@gmail.com. If you want to connect with me, you can do that on LinkedIn as well. Eric Christensen, PharmD, BCPS, BCGP. And take advantage of your free 31-page PDF as well at reallifepharmacology.com. Thanks so much for listening. Take care, and I hope you have a great rest of your day.